Good morning, everyone. Today I am going to discuss muscle re-education. Muscle re-education is an important component of physiotherapy that helps patient regain normal muscle function after injury, surgery, immobilization, or neurological disorder. When a muscle becomes weak or loses its ability to contract properly, the connection between the brain, nerves, and muscles may be affected. Muscle re-education aims to restore this connection and retrain the muscle to perform its normal function. The main objectives of muscle re-education are to improve muscle strength, coordination, balance, and functional movement. It helps patient relearn movements record for daily activities such as standing, walking, climbing stairs, and maintaining proper posture. Various techniques are used in muscle re-education, include active exercises, resisted exercises, proprioceptive training, biofeedback, and electrical stimulation. In physiotherapy practice, muscle re-education plays a vital role in the rehabilitation of patients with orthopedic injuries, nerve injuries, stroke, and other neuromuscular conditions. Now, let us discuss the principles, techniques, and application of muscle re-education in detail. Now we have learned the aims of muscle re-education. To restore normal muscle function, to improve muscle strength and endurance, to re-establish voluntary muscle control, to improve coordination of movements, to prevent muscle atrophy and joint stiffness, to improve balance and postural control, to restore normal movement patterns, to enhance functional activities such as walking, standing, and reaching, to improve neuromuscular coordination between the brain, nerves, and muscles, to help the patient regain independence and daily activities. The main aim of muscle re-education is restore normal muscle function and improve the patient's ability to perform daily activities. It helps improve strength, coordination, balance, posture, and voluntary control of muscles while preventing complications such as muscle wasting and joint stiffness. Next, we have learned about the indication of muscle re-education. Muscle weakness following injury or surgery, nerve injuries, stroke and other neurological disorders, prolonged immobilization or bed rest, muscle paralysis, post fracture rehabilitation, tendon and ligament injuries, post operative orthopedic conditions, poor coordination and balance problems, muscle atrophy due to disuse. Muscle re-education is indicated in conditions where the muscle function is impaired. It is commonly used for patients with muscle weakness after injury, surgery, or prolonged immobilization. It is also beneficial in neurological conditions such as stroke and nerve injuries. Where muscle control and coordination need to be restored. The goal is to help patient regain normal movement and functional independence. Now that we have discussed the Indication of muscle re-education. Let us move on to the principles of muscle re-education. This principle guide the therapist in selecting appropriate exercises and techniques to achieve effective muscle recovery. First one is patient's motivation and cooperation. The patient should actively participate in the treatment program. Second one is proper positioning. Position the patient comfortably to facilitate muscle contraction. Third one is relaxation. Unnecessary muscle tension should be minimized. Progressive training. Exercise should progress from simple to complex and from easy to difficult. Repetition and practice. Frequent repetition helps establish correct movement patterns. Use of sensory stimuli, visual, auditory, and tactile, can enhance muscle activation. Avoid fatigue. Excessive fatigue should be prevented as it may reduce muscle performance. Functional training. Exercise should be related to daily activities whenever possible. Feedback. Continuous feedback helps the patient perform movements correctly. Regular assessment. Progress should be monitored and the program modified as needed. The principles of muscle re-education focus on restoring normal muscle activity through proper positioning, repetition, and gradual progression of exercises. Patient cooperation, motivation, and regular practice are essential for success. Feedback and functional training help ensure that regained muscle activity translate into improved daily activities. Now that we have discussed the patient evaluation for muscle re-education. First one is patient history. Cause of muscle weakness, duration of symptoms, previous treatment and medical history. Second one is observation. Observe the posture, muscle wasting, deformities, abnormal movement patterns. Third one is muscle strength assessment. Manual muscle testing, MRC grading 0 to 5. Then range of motion assessment, active range of motion, passive range of motion. Neurological examination like sensation, check reflexes and motor function. Coordination and balance assessment, ability to perform coordinated movements, static and dynamic balance. Seventh one is functional assessment, walking, standing, transverse activities of daily living. Pain assessment, location, intensity, and effect on movement. Before starting muscle re-education, a thorough patient evaluation is essential. This includes taking a detailed history, observing posture and muscle wasting, assessing muscle strength using MMT, evaluating range of motion, and examining neurological function. Coordination, balance, pain, and functional abilities are also assessed. The findings help the therapist design an appropriate rehabilitation program tailored to the patient's need. After evaluating the patient, the next step is assess the strength of individual muscles. The most commonly used method is manual muscle testing. MMT helps determine the degree of muscle weakness and provides a baseline for planning muscle re-education and monitoring progress during rehabilitation. Introduction to MMT grading. Manual muscle testing grade muscle strength on a scale 0 to 5. Each grade represents the muscle ability to contract and move against gravity or resistance. Understanding these grades help the therapist select appropriate exercise and track improvement over time. The manual muscle testing grade 0, muscle power 0, no visible or palpable muscle contraction. 1, trace, slight muscle contraction, felt or seen but no movement. Second one is poor, full range of motion possible with gravity eliminated position. Third one is fair, full range of motion against gravity, no resistance. Fourth one is good, full range of motion against gravity with moderate resistance. 5, normal, full range of motion against gravity with maximum resistance. Manual muscle testing or MMT is used to assess muscle strength. Grade 0 indicate no muscle contraction. Grade 1 shows a trace contraction without movement. Grade 2 means the patient can move through the full range only when gravity is eliminated. Grade 3 indicate full movement against gravity. Grade 4 means the muscle can withstand moderate resistance. And grade 5 represent normal muscle strength with the ability to resist maximum resistance applied by the examiner. Now that we have assessed muscle strength using MMT grading, the next step is to plan muscle re-education according to the patient's muscle power. Muscle re-education follows a systematic order, progressing from very weak muscle to normal muscle function. This graded approach ensures safe and effective recovery while preventing fatigue and injury. The techniques used in muscle re-education vary depending on the MMT grade. As muscle strength improves, the exercises are progressively advanced from simple muscle activation to functional activities and resisted exercises. Next, we look at the muscle re-education should follow a certain orders. The 4 pillars of muscle re-educations are activation, strength, coordination, and endurance. Motivation encourage patients' involvement, relaxation reduce unwanted muscle activity, concentration help the patient focus on the target muscle, and the repetition reinforces correct movement pattern. Together, these pillars form the foundation of successful muscle re-education. First one is activation. Activation is the first step in muscle re-education. The goal is to help The patient initiate and feel a muscle contraction. This is especially important when the muscle is very weak after injury, surgery, or nerve damage. Techniques such as tactile stimulation, assisted movements, and electrical stimulation may be used to facilitate muscle activity. Second one is strength. Once the muscle can be activated, the next step is to improve strength. Strengthening exercises are introduced gradually according to the patient's muscle power. Resistance is increased progressively to help the muscle generate greater force and perform functional activities effectively. After gaining adequate strength, the focus shifts to coordination. Coordination training helps the patient perform smooth, accurate, and controlled movements. Repetitive practice and functional activities improve the timing and interaction of muscles, resulting in better movement efficiency. The final stage is endurance training. Endurance refers to the muscle's ability to sustain activity over a prolonged period without fatigue. Repeated exercises and functional tasks are used to improve endurance, enabling the patient to perform daily activities efficiently and independently. Therefore, muscle re-education follows a systematic order. First activation, then strength, followed by coordination, and finally endurance. This sequence ensures safe and effective restoration of muscle function. Now that we have understood the order of muscle re-education, let us discuss the treatment approach according to different MMT grades. We will begin with grade 0, which represent the absence of any visible or palpable muscle contraction. At this stage, the primary goal is to stimulate the muscle and prevent secondary complications while preparing the patient for active muscle recovery. In grade 0 muscles, there is no detectable muscle activity. Therefore, treatment focuses on maintaining joint mobility, preventing contractures, improving circulation, and facilitating muscle contraction through various therapeutic techniques. Next, we look at the grade 1 muscle re-education. Grade 1 indicates the trace muscle contraction. Grade 0 blending muscle stimulation and passive movements. Grade 1 indicate a trace muscle contraction that can be seen or palpated but no joint movements occurs. First one is facilitation techniques, tapping over the muscle, brushing, quick stretch and vibration. Active assisted exercises. Therapist assist the patient while encouraging voluntary contraction. Electrical muscle stimulation used to facilitate muscle contraction when appropriate. Biofeedback training help the patient recognize and improve muscle activation. Gravity eliminated position. Place the limb in a position where gravity does not oppose movement. Mental practice. Ask the patient to visualize and attempt the movement repeatedly. Maintain joint mobility. Passive range of motion exercise to prevent stiffness and contractures. In grade 1 muscle power, a slight muscle contraction is present, but it is not strong enough to produce movement. The main goal of treatment is to facilitate and strengthen this initial contraction. Techniques such as tapping, quick stretch, vibration, electrical stimulation, and active assisted exercise are used. The patient is encouraged to concentrate on the muscle and attempt repeated contraction to progress to grade 2 strength. Next, we look at the grade 2 muscle re-education. Grade 2 indicate that the muscle can perform full range of motion only when gravity is eliminated. Active exercise in gravity eliminated position. As patients performed movement independently with the gravity removed. Active assisted exercise. Assistance is provided when needed to complete the movement. Repetitive practice. Frequent repetition improve neuromuscular control. Facilitation techniques. Tapping, bruising, quick stretch and verbal encouragement. Hydrotherapy. Water support the limb and make movement easier. Progressive increase in range. Encourage the full range without fatigue. Functional activities. Simple activities that promote muscle tone. In grade 2 muscle power, the patient can move the limb through its full range only when gravity is eliminated. Therefore, exercises are performed in gravity eliminated positions, such as moving the arm on a table, surface, or performing side lying exercises. Repetitive active movements, active assisted exercises, and facilitation techniques help improve muscle strength. The aim is to progress the muscle to grade 3, where movement against gravity becomes possible. Next, we look at the grade 3 muscle re-education. Grade 3 indicate that the muscle can perform full range of motion against gravity but cannot tolerate additional resistance. Physiotherapy treatment. First one is active exercise against gravity. Perform full range movements independently against gravity. Repetitive exercises. Increase the number of repetitions to improve the muscle control and strength. Functional training. Practice activities such as standing, walking, reaching, and stair climbing. Improve postural control and muscle stability. Coordination exercises and train smooth and controlled movement. Light resistance preparation. Introduce very minimal resistance as tolerated to prepare for grade 4. Endurance training. Gradually increase exercises duration to reduce fatigue. In grade 3 muscle power, the patients can move the limb through the full range of motion against gravity, since the muscle cannot yet withstand resistance. Treatment focused on active exercise against gravity, functional activities, and coordination training. Repeated practice improves muscle performance and prepare the patient for the next stage, where the resistance can be added safely. Next, we look at the grade 4 muscle re-education. Grade 4 indicate that the muscle can perform full range of motion against gravity and moderate resistance. Progressive resisted exercise use weight resistance band or manual resistance. Functional strengthening practice activities related to daily living and occupational tasks. Endurance training increase repetition and duration of exercises. Coordination exercise improve precision and control of movement. Balance and postural training enhance stability during functional activities. Task oriented exercises stimulate real life movements and activities. Gradual increase in resistance. Progress resistance according to the patient's tolerance. In grade 4 muscle power, the patients can move through the full range of motion against gravity and moderate resistance. The focus of treatment is on strengthening the muscle further through progressive resistive exercise. Functional activities, balance training, and endurance exercise are also included. The aim is restore near normal muscle strength and the patient to achieve grade 5, which represent normal muscle function. Next, we learn about the grade 5 muscle re-education. Grade 5 indicate that the muscle can perform full range of motion against gravity and maximum resistance. Muscle strength is considered as normal. Advanced strengthening exercises continue progressive resistance training to maintain strength. Functional training perform complex daily and occupational activities. Endurance training improve the ability to sustain activity for longer period. Balance and agility exercise enhance overall physical performance and coordination. Sports specific or work specific training for athletes and individual returning to work. Maintenance exercise program, regular exercise to maintain muscle strength and flexibility. Injury prevention education, teaching proper posture, body mechanics, and exercise techniques. Next, we look at the advantages of muscle re-education. Restore normal muscle function, improve muscle strength and endurance. Muscle re-education offers several benefits to patients undergoing rehabilitation.
It helps restore normal muscle function, improve strength, coordination, balance, and endurance. It also prevents complications such as muscle wasting and joint stiffness. Most importantly, muscle re-education enables patient to regain independence in daily activities and they return to their normal lifestyle more effectively. To summarize, the muscle re-education is an important rehabilitation technique that helps patient regain muscle control, strength, coordination, and endurance. Treatment is planned according to the patient's muscle power, progressing from grade 0 to grade 5. Through proper assessment, appropriate exercises, and regular practice, muscle re-education restore normal movement and functional ability, enabling patients to return to their daily activities with confidence. Thank you.